Go.
Hello, my name is Katherine Amps. I'm a student physical therapist assistant at Jeff State, and today I'm going to be talking to you about an ACL repair treatment plan. So just a little bit of history about our patient. She is a 19-year-old female that is 3 days status post right knee ACL repair. The ACL is one of the most commonly injured ligaments of the knee. The ACL can be injured if the knee is bent backward, twisted, or bent side to side. Our patient injured her right knee playing basketball. She complains of pain that increases with knee flexion and gait without crutches. Her primary goal is to return to basketball so she can maintain her scholarship. Patient's right knee extension is measured at 15 degrees, flexion is only at 80 degrees, and her active range of motion and passive range of motion are limited by pain. We're going to be doing some patellar joint mobilizations today, which is going to help with her patella mobility. Because of the knee surgery, the knee develops edema and swelling and also scar tissue, which prevent the patella to move, so it decreases the mobility. So by providing these joint moves, it's going to help bring that mobility back up and increase her range of motion. So we're going to do them in two directions. We're going to do a medial lateral direction and a superior and inferior direction. So we'll do medial lateral first, and what we're going to do is just going to slowly, gently move the patella from side to side. So we're going to do a set of 10 reps. Just like this. Shouldn't be too painful. Okay, so now we're going to do them in a superior and inferior direction. So same thing, we'll do this 10 times. Like I said, this is going to help with increasing the mobility of patella, which will allow the knee to straighten, because without the patella, we wouldn't be able to fully straighten our knee. She has right patella. Her right patella is decreased in all directions because of her surgery. And you can see in her chart, her right knee is warm and boggy with the edema. So again, this is going to help with her mobility. Okay, does that feel okay? Okay. That's it. Same button. Okay, so now we're going to be going over some patient education. What we're going to do, we want her to ice and elevate because of all the swelling we have and the pain that is caused by that. We want to make sure when you're at home and you're sitting down and resting, always elevate, and then you can ice it for about 15 to 20 minutes throughout the day. Okay. So with the ice, you're going to experience something we call CBAN. So it'll be cold, it'll have a burning feeling after that, maybe aching, and then numb. Okay. But if for any reason, once it gets numb, it's done what it's supposed to do. So you want to take it off, give it a breather for a while, then you can always ice it again. Okay? So when you're elevating, you want to make sure to have a little bit of support under the knee, but you don't want to leave it bent. Okay? You want to leave it kind of straight. So we'll elevate just a little bit more. So it's good if you're laying down in the bed, sitting in a chair, just something like this. Okay? Okay. So then you'll have your ice on there. You'll also probably have your wrap steel that they gave you from the hospital, and that's going to help cover your incision. So when you're wrapping that, you want to make sure that it's going to be a little bit tighter down here. And as you go up, it's going to kind of release the pressure, not be as tight. But once you get it wrapped and you notice down here it's changing color or you're losing feeling, you might want to take it off and re-wrap it because it's probably going to be too tight. Okay. Okay. Do you have any questions about that? Okay. So how long are you going to ice it for?
15 minutes.
Okay, good. And once it gets numb, what are you going to do?
Take it off. It's finished.
Okay, great. All right. Okay, so now we're going to be going over a home exercise, and we're going to be doing the calf stretch. So we're going to do, I'm going to have you at home while you're sitting. We're going to be using this towel. You can use towel roll, pillowcase, whatever you have around. I'll go ahead and show you. You're going to just be sitting here. You're going to have that knee extended. You're going to roll this up. Like I said, you can use a sheet, towel, pillowcase like I have here. And you're going to keep that knee straight. And you're just going to pull back just gently, not too hard, until you feel a good stretch. Okay, once you get to that point where you have a good stretch, you're going to hold it for 30 seconds. Okay. Okay, so you're going to hold for 30 seconds, you're going to do 5 reps. So 5 for 30 seconds, okay. You're going to do that 3 times a day. Okay. Okay, so when you're doing these, I want to make sure you're not pulling too far. You don't want to cause yourself any additional pain because it shouldn't be painful. Okay. You're just going to have a good stretch. You want to continue breathing while you're doing that. And, just take a break if you need it. If you can't do all 5 in a row, that's fine. You can take a break in between. Do you have any questions? Okay, so I'm going to have you hop up here. Okay. This is going to help promote knee extension and also decrease that tightness in your calf here, and also stretch all the way back to your leg, okay?
Okay.
So I'm going to go ahead and give that to you.
Okay. Oh yeah.
Good.
Pull and hold for 30 seconds.
Just pull till you feel that good stretch. You got it?
Yeah, I'm feeling it.
Okay, so we're going to hold that for 30 seconds.
Okay.
I'll let you know. So, when we measured your knee last, your extension was only at 15 degrees.
Okay.
So we want to do this to help. It's going to help promote that extension like I mentioned just a second ago. Your flexion was 80, but we're working on extension right now.
Okay.
And stretching out back your leg there. Okay, so that's 30 seconds.
Okay.
Take a breather for about 5 seconds.
Okay.
And we're going to do, I'll go ahead and let you do one more today, but at home I want you to do 5.
5.
Yeah. Okay. Hold that for 30 seconds. Do you have any questions?
But I feel this one.
Okay. Good.
Alright.
Alright, so how many times are you going to do those? 5. 5 times a day. And hold for how long?
30 seconds.
30 seconds. And how many times throughout the day?
I forgot.
3.
3 times a day. I won't
Yes.
forget. I promise.
Okay. Well, that's it. So now we're going to go over a little bit of the patient's prognosis. Her rehab potential is excellent. Given that her past medical history is unremarkable, I expect that she has a full recovery. I expect she will be able to return to basketball, but she might have to wear a brace for extra support. Just maybe, maybe not for her whole basketball career, maybe just the beginning, but she might prefer that she have it the whole time just for that extra support. During her follow-up visit with her doctor, her only restrictions in rehab were to avoid ballistic activities such as jumping and running for the next 8 weeks. When she came back in for her reevaluation 6 weeks later for physical therapy, she no longer had pain with her right knee, active range of motion and passive range of motion, and she is now able to ambulate independently on level surfaces. So like I said, her rehab potential is excellent, and I expect that she would have a full recovery.